The Queen Alexandra Hospital in Cosham continues to be anchored to the bottom when it comes to waiting times for its A&E. A report for the House of Commons released last week showed that in Portsmouth about 1/3 of patients waited over 4 hours, the fifth worst in the whole country.
It's a big worry. We know that there have been huge waiting times for ambulances at A&E, at QA, and and as I'm not just a local representative, I'm also a local resident and a local mum. So it's in everybody's interests that we get this right. But there are areas where we have problems, and the A&E, I suppose, is the big ticket item. It's the one we've all seen the pictures of the ambulances queued up outside the entrance of QA, and that's and we need to make sure that robust and resilient service is there when local people need it.
And it's having a knock-on effect. The ambulance service in the area admitted that queues outside A&E meant patients were waiting longer for an ambulance after calling 999.
It does mean on occasions that those patients who are less poorly may have to wait a little bit longer for an ambulance at that time. What we do need to do during those periods of high demand where there may be ambulances outside the hospital is we focus then on prioritising our response to other patients with the resources that remain available, so that we make sure that we respond to the most poorly patients at all times in a timely manner.
And patients are continuing to suffer. One man we spoke to had his operation cancelled 3 times in the last 6 months. A mother described arriving at the maternity ward to find no bed available for her. After a damning report by the hospital's watchdog last year, the Queen Alexandra has improved. Their last major inspection by the Care Quality Commission said the hospital had got better but still requires improvement. The report said patients arriving at the hospital were being assessed faster and praised the care and respect of staff towards patients. But the CQC report pointed out that ambulance patients were being left in a corridor with no one observing them and no way of calling for help. They also highlighted delays caused by a lack of empty beds, patients were moved frequently, sometimes at night, and the number of patients experiencing a delayed discharge was actually going up. There were also concerns from staff that improvements wouldn't be sustained. Worryingly, the report also said senior management at the hospital was disengaged and not listening to staff. But Solent has repeatedly requested an interview with senior management at the hospital to explain its situation for you, our viewers. We received a variety of responses. At one point we were told the hospital was too busy with patients, so management couldn't see us. The following week we were told the hospital was no longer on high alert as the overcrowding had been solved, and so speaking to us wasn't a priority. We were later told that the management just didn't want to do TV interviews. We requested a statement from the hospital responding to our queries, but they failed to get back to us. A national charity that's been working in Portsmouth to try to get patients moving through the healthcare system here better told us the management at the hospital were not engaging in issues in the wider community and were failing to follow through on strategy. Hospitals across the country are facing difficult times. But despite improvements, Queen Alexandra, it seems, still has a long way to go before it can be said to be really on the mend. Charlotte Biredny, that's Solent.